Good morning friends, welcome on my channel Charming Science. Today we are going to talk about the bone pisiform. When we are talking about the pisiform bone, the pisiform is one of the 8 and the smallest carpal bone that form a part of the wrist bone. The name pisiform is derived from a word pisum which means pea. It is a sesamoid bone and having a spherical shape with a distolateral long axis. It bears a articular surface for the triquetrum and form a piezotriquetral joint, and it provides attachment for the two muscles and three ligaments. When we talk about the function of the pisiform, so we can feel it underneath the our palmar aspect of the hand toward the ulnar side. At here it's present onto the palmar surface. The pisiform bone along with the hamulus of the hamate defines the medial border of the carpal tunnel and act as the one of the four attachment for the flexor retinaculum, and it also provide attachment to the abductor distal minimi flexor carpi ulnaris. It act as the pisiform bone is act as a pulley for the flexor carpi ulnaris tendon and provide a smooth surface for the tendon to glide over it. It also form a ulnar border of the carpal tunnel and contribute to the formation of the ulnar canal. This structure is known as the ulnar canal, and it is also known as the Gans canal, which provide a passage for the way of the ulnar nerve and the ulnar artery. The ulnar artery sits adjacent to a lateral surface groove of the pisiform. When we talk about the site determination or the sites of the pisiform, then it's having a four surfaces: the dorsal surfaces, the palmar surface, the lateral surface, and there is one as the medial surface. So when we see the dorsal surfaces, we will find here that it's having a concave facet. When we talk about the surfaces of the pisiform bone, then we will find that it's having a four surfaces, that is the dorsal surface, the palmar surface, the lateral surfaces, and one is the medial surfaces. So when we look at the dorsal surface of the pisiform bone, we will find it's having a concave surface. It's having a smooth concave oval surface, and it provides a attachment for the triquetrum bone, or we will also known as it as a triquetrum facet, which provide attachment site for the triquetrum bone. When we see the pisiform or the pisiform palmar surfaces, we will find it's having a rounded and rough. We'll see that it's having a roughly rounded and rough structure, and it provide attachment to the transverse carpal ligament, flexor carpi ulnaris, and the abductor distal minimi. When we will see the lateral surface, it's having a rough and concave. It's having a rough and concave structure. We'll see here. that it's a rough and concave structure. Onto the medial side, it's having a rough and usually a convex structure. This is a triquetrum facet which is present onto the pisiform bone for making the pisotriquetrum joint. When we talk about the muscular attachment, then we will find here that the flexor carpi ulnaris and the another one abductor disti minimi, the flexor carpi ulnaris and the abductor disti minimi is going to give attachment on it. The flexor carpi ulnaris is an extrinsic muscle that attaches the pisiform hook of hamate and fifth metacarpal, and it allows wrist flexion and adduction. Abductor disti minimi is a hypothenar muscle and it allows abduction of fifth finger and flexion of its proximal phalanx. When we talk about the ligamentous attachment, then the piezo-metacarpal ligament, piezo-hamate ligament, and the ligament for the flexor retinaculum is going to attach on it. When we're talking about the arterial supply of the pisiform bone, the ulnar artery provides vascularity with branch entering both the proximal and distal surfaces. The proximal vessels enter inferior to the triquetral facet near the tendon of the flexor carpi ulnaris, and the superior and inferior branches run beneath the articular surfaces. When we talk about the ossification points of the pisiform bone, then it's only having a primary ossification point that start ossifying from the 9th month and it completed approx 12th year. It's its ossification from the 9th year and it's completed its ossification to 12th year. It's not a 9 month, it's a 9th year and it completed its ossification till 12th year. When we talk about a clinical condition, then the pisotriquetral joint is the primarily affected in the case of the osteoarthritis of the hand. That's all for the pisiform bone. Thank you.